Good evening, everybody. Thank you so much for joining me tonight on YouTube Live. I'm Dr. Howard Elkin, medical advocate. Happy New Year to you all. And tonight we're going to focus on the vagus nerve and the autonomic nervous system. So it's all about Viva la vagus nerve. And it's very exciting. And this is a great time to think about it. And there's been so much hoopla about the vagus nerve lately, and for good reason, because most of us are walking around being sympathetically overdriven, right? It's fight or flight. And we need to be more balanced, and we need to have more Zen-like quality to our lifestyle. And that's why we look at the parasympathetic nervous system and also the vagus nerve. It potentiates that calm Zen-like state that we are all trying to obtain, right? I mean, the vagus nerve is really your weapon in fighting stress. And God knows we're living in very stressful times. It plays a great role in PTSD, post-traumatic stress disorder, generalized anxiety, and insomnia. So it's all about calming the mind and using tools that help us to stimulate the vagus nerve. Now let's back up a little bit and talk about the nervous system. There are really two major components: there's the central nervous system and the autonomic nervous system. The central nervous system is like the brain and the spinal cord. That allows me to, pick up this object, pick up a pen. I know exactly what I'm doing, so I'm consciously doing it. So that's your central nervous system, your brain and your spinal cord working. But what we need is also, what about all the autonomic symptoms? And so what happens, the autonomic nerves, they branch out from the spinal cord and they serve all regions of your body. And we're talking specifically about your viscera, your heart, your lungs, your intestines, your pancreas. All these organs are being governed by the autonomic nervous system. And we don't have to think about breathing or think about urinating or defecating or sexual arousal. These things that just happen automatically, but they can't happen without an intact autonomic nervous system. So we really need both the central nervous system and the autonomic nervous system. Now, the autonomic nervous system, which means things are automatic rather, are really two major components. There's actually three, but we're going to focus on two tonight. One is the sympathetic nervous system, which is fight or flight, and the other is the parasympathetic nervous system, which is the calm Zen-like quality that we are achieving. Now it's not just that you have these two systems working independent. The autonomic nervous system actually does work with the brain in concert to the hypothalamus, which is a part of the brain. So it's kind of a relay between the central nervous system and the autonomic nervous system. Like I said before, the sympathetic nervous system is fight or flight. I don't think any of us need any instruction in that. I mean, and this is a problem of today, is that we are in the state of fight or flight. Now, in the olden days, ancient days, okay, it was really important if you were being chased by a saber-toothed tiger, right? You had to run. You had to get out of the situation. Or let's say there's a catastrophe at home or an earthquake or a fire. You need the fight or flight at those times. When you exercise, your body has to increase its cardiac output by 3 or 4 times in order to feed the muscles, or you wouldn't be able to exercise. So again, that's sympathetic. There are times when you really need it. But here's the problem. Most of us are walking around in the state all the time. Okay, we never shut it off. We're not able to shut it off. So we're sympathetically overdriven when we don't really need to be, and we shouldn't be. So that's where we really need some help from the parasympathetic nervous system. And so it really governs, it's all about storing and restoring and taking care of our digestive system and limiting waste. It's all the autonomic things that we don't think about. Now, and here's, not only are we living in a turmoil right now, the United States is in a state of turmoil, as is the world at large. But in this country, I'll speak for this country right now alone, that we are not healthy as a nation, okay? 60% of us have at least one chronic illness, and 40% of us have 2 or more chronic illnesses. And over 60% of the population is taking at least one prescription medication. There's still about 750,000 heart attacks every year in this country. And besides that, we are metabolically unhealthy with diabetes, prediabetes, and metabolic syndrome and obesity. Really, only 5% of this nation is metabolically healthy. So we aren't healthy, and we're living in turmoil. So it's really a tough time. That's why this is so important. Why I need to drum this home to everybody. 67% of adults eat processed food. 70% of children eating processed food. So it starts off with our younger generations, they're not doing well. So a couple more facts. Most people over the age of 40 have poor vagal tone, which is the nerve that really governs the parasympathetic nervous system, which means this is exacerbated by difficult pregnancies as we get older, and definitely by past emotional loss and trauma. For the vagus nerve, which is the largest nerve in the body, which we'll talk about in a minute, innervates all the visceral organs, like I've said before. It upregulates enzymatic activity, which means your digestive enzymes and so forth are being upgraded, which is really important because these things kind of go by the wayside as we get older. So it allows you to digest better, it allows you to absorb better, and also have better motility, more gut motility. A big thing we see as we get older is constipation. So we need the parasympathetic nervous system, and along with the sympathetic nervous system, but we need to really work on the parasympathetic nervous system because most of us really don't know how to get it, bring it about. And that's where the vagus nerve comes in. Okay, so if you only work, I just want to remember two things about the vagus nerve from me. Two functions: rest and digest. Rest and digest. That's what the vagus nerve is famous for. So like I said, the vagus nerve is the largest cranial nerve that we have. It's 1 out of 12, actually. And all the other cranial nerves actually govern supply the face, the nose, the ears, the eyes, the larynx, everything from the neck on up. Whereas the vagus nerve, which is the longest nerve, actually innervates various organs, all the organs: heart, lungs, viscera, liver, gallbladder, et cetera, et cetera. So it's got a big role. Now, and the other interesting thing about the vagus nerve, it has both sensory and motor outputs. It means it can sense things from the periphery and then send a motor function back through. So it's like a dual function, both sensory and motor. So it can do a whole lot. And this is also what I found. This I just did learn recently, is that with increased vagal tone, or really exercising the vagus nerve, it improves your vagus tone, will also decrease inflammatory cytokines. Now, I know you all heard about cytokines, especially during COVID. We called it cytokine storm. These are people that died because they had so much inflammation and we didn't know how to deal with it back then. So with increased vagal tone, you have less cytokines, which means less pain, which means less inflammation. So it's a win-win situation. Now, as a cardiologist, why would I be interested in this? Because a lot of the functions that I deal with the cardiovascular system are automatic, okay? Like heart rate, heart impulse conductivity, the electrical impulse of the heart, and also contractility. How hard does the heart have to pump? And so really, the vagus nerve plays a big role in the cardiovascular system. And like we use resting heart rate as kind of a measure of vagal nerve function and mortality in general. In other words, people that have a high resting heart rate don't do well in the long term. And that's because they have their sympathetic nervous system is more is here, and the parasympathetic nervous system is here. So they're not really side by side, and so their resting heart rate tends to be high. We talk about heart rate variability, which we will discuss in another program. But so really, your resting heart rate is kind of a determinant of your mortality, and it is governed by the vagus nerve. Now, congestive heart failure is the most common cause for hospital admission in those over the age of 70. And of course, in my career, I've dealt with tons of this. And the mortality is striking. And in 30 days, it's a 10% mortality. In 1 year, it's a 22% mortality. And in 5 years, 42% mortality. So it's really bad. The prognosis is quite bad in heart failure. But one of the things we know, besides pump failure, the body responds by increasing sympathetic activity, which is good and bad. It's good because it keeps your blood pressure up and away, but also the hormonal change that take place really create chaos. And we need to work. That's why beta blockers, that were contraindicated when I was a student and a resident, are the mainstay now in treating heart failure, because we have to slow things down and let the heart relax. Now, so how do we stimulate the vagus nerve? Okay, that's really what you want to know. That's the take home message tonight, because I want you guys to practice these on your own. Okay, first of all, breathing. I teach I teach breathing as a part of it's a major component in my practice. So the general, what most people like is a thing called box breathing. I know you've heard of that. So we go in for the count of, we inhale through our nose on the count of four, and then we hold our breath for a count of four, and then we exhale with our mouth open for a count of four. So this is it. I'm going to demonstrate for you. Now it's pretty calming, right? 444. Now I like the Elkin method better because I kind of came up with this, and I'll tell you why I like it. I use a hissing sound on the exhalation because it's calming. It's like an audible cue. And I do 4 in, I only hold two for the breath hold. And I say to myself, 1001, 1002. It's not 1, 2. It's 1001, 1002. Then I exhale on the count of 6. So why? Why not 4? Because most of us, when we get excited and we're really in that sympathetic state, we forget about exhaling. We're always going to inhale, right? We will die if we can't inhale because we have to take in oxygen. But what our problem is, we can't get rid of it. We're hyperventilating. And so air is being trapped in our lungs, and it's not a good thing. So I do it like this. I'm going to demonstrate this for you. This is the Elkin method. Four, two, six. And you do that for I have my patients if they've never done a breathing practice, I have them start off like 10 times in the night. As soon as they get out of bed, before they get out of bed in the morning, I have them work on that. And then also before they go to bed at night, they have to do the same thing, 10 breaths, 10 breaths. And also I have them take 10 breaths if they can before they eat a meal. What happens? The heart rate drops, the respiratory rate drops, the blood pressure goes down, and they'll probably eat less because you're calming yourself. You're using the vagal maneuver, something so simple, to bring it down. Bring it down. Okay. Walking is a great thing, just a plain walk and a warm bath. Every now and then I take a bath in Epsom salt. It's very relaxing. That's Zen-like. Then you got actually vagal maneuvers or vagal exercises, and yoga is famous for that. I'm not a yoga person. I do like Tai Chi, which also works on your balance because you're in the moment when you're doing these things, and that helps to augment a vagal nerve function. Now, I do something called the dive reflex. I don't think many of you guys are going to like this. So I have a pail of ice water and I dunk my head in it. I know it sounds crazy, but it's a great vagal maneuver. It's been used forever. It'll slow everything down. I mean, first it's just you get a little excited, but it'll slow things down for quite some time. That's called the diving reflex. You can also take a cold towel and put it on your forehead. That would work as well. Chanting. Okay, I'm a singer, so I have all these tapes. I'm spending a lot of time in the car, so I sing, and I have these tapes with scales and accompaniment. Okay, so I just sing, and I'm singing loud as I can because first of all, I'm working on my singing, but also the louder you sing, the more you augment your vagus nerve. So it's a really good thing. Then there's a couple of exercises. I'm going to just do the easiest one because it's so easy to demonstrate. It's called the head tilt, and I think I did this about a couple of years ago when I talked about relaxation techniques. So basically, we're going to tilt our head from one side to the other. I use the arm because what happens. Most people are used to doing a head tilt. They have a head turn, but not a head tilt. So this can help you. Yeah, you don't want to press it down. You just want to hold your head like this and just gently apply slight pressure. And you want to look to the opposite side. So if I have my right arm on my head like this, I'm going to look up to the left. So I'm looking up to the left, and I do this for 30 seconds. Then I change. Now, so I got in the head tilt position. Okay. Now I'm going to look to the right for 30 seconds. Do this about 2 or 3 times. It really calms you down. I've actually done this numerous times. It really helps. Then we have this new thing called vagus nerve stimulators. Now, I got interested in this a few months ago. So I have this device, and I'm going to talk about called Gamma Core, GAMA Core. It's a great device. I'm going to demonstrate it for you in a moment. Now, since I got this device and I'm using it from I've used it for myself and my patients, there's like 6 or 7 devices out there because they know that I'm interested in it. I get all these ads on Facebook and Instagram, like try this one, try that one. There's like 6 or 7 already that have come out since I purchased this unit. That tells you how hot this topic is. The problem is most of these are not really FDA approved and they don't have many studies or research behind it. So I chose the one that does. Um, so and I'll show you. So, what are the benefits? Now, gamma core is actually indicated for prevention and treatment of migraine. So, I don't suffer from migraine, but I have certain friends that do, and it can be debilitating. This is a non-pharmacologic way of dealing with it. So, if you do it on a regular basis, that'll help prevent further migraines, and it's also very helpful if you're having an acute migraine as opposed to taking injections and pills and other things, then locking yourself in a dark room for 12 hours or so. This will really speed up that particular process, which is pain relief from of migraine or other headaches in general as well. I'm very interested in this because you're going to see a lot of studies in the near future on generalized anxiety and insomnia. I mean, one of the biggest things in longevity medicine today is sleep hygiene. People aren't sleeping well. There are people that have used this device that have found that their sleep is much better. They fall asleep quicker and they stay asleep longer. So it's a big deal. I would definitely recommend something like this over a sleep aid because I don't think, well, there's a few herbal preps, but as far as the pharmaceuticals are concerned, there's no hangover. There's nothing long term with the use of gamma core. So definitely sleep, definitely generalized anxiety and generalized anxiety, which is rampant now. And that really, we saw a step up in anxiety with COVID. I mean, this whole thing about staying at home and social isolation really did a lot of bad because we need to be embraced by others. It's to me that's one of my 5 components of wellness that I'll talk about another time, and that is social well-being. Well, if you're isolated, you can't do it. And I saw elderly people come in with insomnia and panic attacks that they had never had before, just being locked up at home and they couldn't do anything, especially if you live alone. We talked about headaches, pain in general, like fibromyalgia. There's no great medicines for that. It's pain here, it's pain all over, and I don't know what the latest and greatest is since I don't really treat that. Part of what they have is they have sleep disturbances for sure, major sleep disturbances, and that's one thing that we can work with gamma core. But it has been used for pain relief as well, and generalized fatigue, and of course, fatigue does go along with fibromyalgia. But even by itself, there have been many reports of people that actually having enhanced energy with vagal stimulation. And the other one that I'm very interested in is gut motility, because I think we all know, if you know anything about me, that the gut is really your second brain. If your gut's not healthy, you're not healthy. I don't care what you're doing, but you are not healthy without your gut. And what do I see? I see leaky gut, we call it dysbiosis. I see, IBS. I have constipation and diarrhea, but constipation is a big problem, especially if you're taking if you're taking pharmaceutical medication, right? Pharmaceuticals. So this stimulates gut motility. Remember, rest and digest. That's the vagus nerve. Rest and digest. So we're going to move things along the pipe, your intestinal, with increased vagal tone. So again, a non-pharmaceutical approach to wellness. So that's basically it. I think this is a very important talk because I think, like I said, we're living in such stressful times right now with the election year coming. That's even going to produce more stress, right? So again, we're living in turmoil, not just this country, the world at large, and we are not a healthy country. If you look at the longevity standards, and I think the United States is like number 33 or 34, which means 33 or 34 other countries do better than us with regard to lifespan. Okay, and what I'm looking for actually is, a health span over lifespan, because it's not so much about adding years to your life as adding life to your years. So I think by balancing our our peripheral, our autonomic nervous system, we don't need to have any instructions to fight or flight. I think we all know how to handle emergency situations, but we aren't living in emergency situations every day, and that's when the vagus nerve comes in handy. And I'm going to demonstrate this very quickly so you know how easy this is. Okay, so this is gel. Okay, so you put a little bit of gel on the little. I'm going to see if we can watch this. I'm not used to demonstrating things. Okay, a little bit of gel here, a little bit of gel here. Okay, that's it. Okay, because you have to have gel for it to conduct electricity. Okay, then you find your vagus nerve. Now, your vagus nerve is right behind your carotid artery, so it's pretty easy, unless you have an unusually large neck, to find your carotid artery. So I put my two fingers here for my carotid artery, and then this is going to be right there. So I'll put this on, clicking on. There's a little green light that comes on that tells you that it's on. I don't know if you can see that. There it is. And then I hold it here and I increase the intensity until I feel it. I'll let you know when I feel it. Okay, I'm already feeling it. So within a few seconds, you're going to feel electrical stimulation. And so you know it's working. If you can feel the stimulation, it's working. You don't have to guess about it. And it's done. It's a 2-minute timer, so you don't have to even time yourself. It's 2 minutes here, then you do the other side, or you can do the same side twice, but I would suggest doing the other side. So this is what you do, and you do it twice a day, and you do it for 3 months. I don't know the magic behind doing it, 3 months, but that's what they recommend. And there have been studies on this device, and more studies are being performed as we speak. So I'm really looking forward to more research in the next couple of years, because I really think this is the future. Because if we balance our autonomic nervous system, I think we're going to be a lot better off, a lot calmer. We'll have better sleep. We'll have less anxiety, and hopefully we'll have better clinical outcomes. So that's it. So I'm going to look for questions here. Get my glasses on so I can read them. Okay. Doctor, what are your thoughts? Cacao for heart health or blood flow. Okay, blood pressure. Um, is that so? Cacao is actually basically it's chocolate at its root. Flavonoids. Well, first of all, it's kind of beyond the topic that we're talking about right now, so I'm not going to spend much time on it. It's very good. Any polyphenols are very good for your heart. Polyphenols, and you certainly get enough with caffeine. I'm sorry, and with chocolate and coffee. Why they're considered health foods. So I do use them. I do recommend them. Okay, but let's tilting of the head while pulling on it was more relaxing than than it looks. Well, it's hard to teach you on, because you have to remember I'm here. I'm alone with a ring light and iMac. So but it is pretty relaxing. You just tilt your head to one side. I like using the hand. You're not pulling, you're just really pressing it here. But you have to make sure you gaze at the opposite. So if you're left side, you're gazing at the right, and vice versa. It is very comfortable, and the hold is very important for 30 seconds, not just 2 or 3 seconds. And you do it 3 or 4 times, and you will feel better. Okay, let's see. Who? Okay, I got to see this. Why the lighting is so bad? Hold on, I'm going to. Okay, let me get better lighting here. Give me 1 second, guys. For some reason, the lighting is terrible today. Okay. Okay. That's not working. Okay. Talked about okay. Is it a goal to stimulate the vagus nerve or calm it? Well, stimulating the vagus nerve is going to calm you. So you have to stimulate the nerve to bring about an enhanced or a calm-like or Zen-like state. We want to be Zen-like. We want to be more calm. Like I'm an adrenaline junkie by left to my own devices. So this is really important. I do meditation every day. I do a regular practice. Like I said, I sing in my car as loud as I can. I take cold showers and cold baths, cold showers rather. I do diving reflexes. These are all to exercise my vagus nerve, because it's like a muscle, really. Although it's a nerve, you use it or you lose it. So if you constantly are doing vagal maneuvers, and of course the gamma core makes it very easy, because it's device and it's already time. All you gotta do is just apply it, put a little gel on the electrodes and apply it. So you're stimulating the vagus nerve to produce that calm-like state. Hope I explained that right. Okay, now let me see. Okay, oh, good. A lot of good questions. Do you know Nicholas DePace, MD in New Jersey? No, he wrote a book on dysautonomia. I really know about dysautonomia. Thank you, for Linda, for bringing this out. Um, Dysautonomia is a total imbalance of your central nervous system. My partner had that due to some immunotherapy that he was taking. For 6 months, his blood pressure dropped to like zero. I mean, zippo. He could not stand without, because he was coordinated and relatively small, he was able to put himself on the ground. But if you have severe dysautonomia, your blood pressure drops tremendously. I'm going from sitting to standing. That's an exaggeration of autonomic nervous system imbalance. And we finally found a neurological chiropractor, believe it or not, who knew how to put his balance back together, because his vagal nerve the vagus just went to sleep. It just, it couldn't do it. It couldn't work. So yes, I do know about that, but I have to look up that doctor. So thank you for mentioning that. There's meditating. Yes, meditating is very important. Yeah, meditating is really important. And that's one of the things we recommend for sure. Okay, let's see. I love all these. Doctor, I'm a 54-year-old male in health with no medication. Should I take a low dose aspirin, 81 milligrams? No. Although that's not really the extent of this conversation, but I like to mention it. I've never been one of those doctors that believes that everybody over 55 should be on an aspirin. I've always done it on a case-by-case basis, and the information in the last 3 years, I would say, that actually there's more bleeding taking baby dose aspirin than not. So if you have history of coronary disease, if you are high risk, and I can let you know if you're high risk, then we take a baby aspirin. Okay. But otherwise, it's not recommended for the general use, especially if you're healthy. I mean, why even, so, okay, let's see. Saunas are great. Yes. I like infrared sauna, and it's very relaxing. I think it's just, yeah, I do what's called fire and ice. So I go from an infrared sauna, which is like 144 degrees, after 3 minutes, and then I jump into an ice tank that's about 34 degrees. So it's pretty cold. But I've been doing it for a while. I wouldn't recommend you start that way. But anyway, okay. Let me see. Okay. Who sells a cheap vagus nerve device? I would not go for cheap is better. That's just me. I go for a company that has a reputation, that's done studies, that's got FDA approval behind it. And like I said, if you want to find a cheap device, I'm sure you will find one, but I can't personally recommend it, because I went straight to this device, and this device has been studied pretty well. And so again, is cheaper better? These devices are not that expensive. For example, I have them here. We rent them. We don't sell them. And for 3 months, it's like $500. Now you're doing it twice a day. So that's what, 2 minutes each side. It's like less than 10 minutes a day. I like doing it in the morning, and I like doing it in the evening before I go to bed. It really relaxes me, because when I do it for those 2 minutes on each side, I'm thinking just Zen-like thoughts. I kind of sleep. I'm floating in the clouds, etc. So it's cheaper, better. I can't speak for these other devices, but they're there. There's been a real plethora in these lately. Okay. Okay, tilting the head. Okay, I think I got it all. I just want to make sure I didn't miss anything. Anything else, guys? So like I said, Gamma Core, you can look up GAMMA Gamma Core, CORE. The G is lowercase, and look it up. There are other devices. I just haven't examined them, so I can't speak for them. But Gamma Core I've used it. I like it. I'm about to start again. How often should you do it? When you feel like it's necessary. I've had I would say the last year was extremely stressful for me, 2023, and I thought this is going to be an easier year, but there's a few issues that I'm dealing with. So I think I'm going to do another run, which is 3 months, starting in 1st of February. which is Heart Month. So it'll be really cool. So that's what the company recommends. Any products regarding the compression pants? Um, Compression pants are all, yeah, those are easy to find. Um, you mean compression pants or compression socks, or do you mean compression, the machines that do the compression? There's a lot. So until I don't know a specific answer to that. Oh, it's what you're actually getting at. But again, I just want to make, oh, the machine. The machine, I don't know if you talk about EECP, which is improved circulation, but that is only indicated for angina. And I have that machine in my office, actually. But the indications as far as getting approval by Medicare or by PPO insurance is less. It's not optimal. Okay, but it's a great machine, and I recommend it if you can get it. Like I said, I have one at Heartwise, but the thing is that insurance is really picky. They don't want to pay for it. Remember one thing, folks. Insurance, they don't care. They're not interested in your health. They don't give a damn about your health. That's why I'm so big on becoming your own medical advocate. I mean, it's why I wrote this book, and why the book makes more sense to me now than it did when I wrote it, which was a 10-year process in itself, because I'm seeing the health of this country getting worse and worse every year. The average person isn't listening to me on YouTube. Okay. They're not eating healthy, unprocessed foods. So, so that's my thing. Okay. Is it, yeah, I can get it operational. Okay. Vibration plate. Yes, I have my own power plate. It's called the power plate. I forgot which model. I have the popular floor model, and I try to do it. I use 10 minutes a day. It's very good for treating. First of all, you got, like, if I do a bicep curl, okay, if I do a bicep curl with a let's say a dumbbell, I'll probably do about 3 or 4 contractions per second. Okay, when I'm on that machine, I'm doing like anywhere from 30 to 40 contractions per second. It does it for you. Just standing on the machine. It's amazing. It's great for people that are trying to avoid sarcopenia, which is loss of muscle. And I'm a big advocate of that, because I think muscle is the organ of longevity. If you want to live to a ripe old age and be able to do things, you better have muscle and strength. So it's great for that. It's also very good for bones, okay, because the vibratory nature of the machine stimulates the movement of the muscle, which pulls on the tendon, which pulls on the bone, and you have increased bone turnover. So it's a great machine. Yeah, I call that the best biohack available. We can exercise till the cows come home, but 10 minutes on that machine is just amazing stuff. So it really helps a lot. Okay, let's see. I'm gonna try to miss anything. Thank you. Oh, thank you. Please, Parker, the impression. I think that's it, guys. Um, so think about this and start exercising. You're doing your vagal nerve. You don't have to have the gamma core, because you can do this stuff on your own. But meditation, all this stuff, breathing is important. Box breathing, the Elkin method, because we really need to slow it down. Slow it down. And again, I'm an adrenaline junkie. If I left to my own devices, I'm sympathetically overdrive. I have to really work at it, which is why it's so important to me, because I work very hard on it, and I think other people do as well. So, okay, that's it. I want to thank you all for joining me tonight. Please go to YouTube and give me a review, a thumbs up, I think they call it, if you see any of my videos. Ratings really do help. They really, really help. You can go to my book, which is the website is beyourownmedicaladvocate.com. Again, beyourownmedicaladvocate.com. I think everybody can get something useful out of my book, and also on social media, pretty much. And next month is Heart Month, February. So I'm going to do at least one program, possibly 2. And I think one of the things I want to talk about is all these myths surrounding heart disease and cholesterol. And there's so much garbage out there. There's so much, one of the things, I like to be a barometer of the truth, and so I care about the truth. And I'm not trying to change people's opinions, because you can't do that. But for those of you that are vulnerable and listen to some of this stuff that's being promulgated on the internet, it bothers me that people are getting this kind of information and they don't know what to believe. and I'm just one person. So, but I'll have at least one, possibly two. Okay. So good night, everybody. Thank you for let me get my things here. Thank you for joining me. We'll see you. Like I said, please subscribe. Because if you subscribe, you should be getting an alert about the next program is. I would imagine we'll do one probably not the first week, probably the second week in February. More than likely, I'll be doing my first one. Okay, see you then. Thank you so much. And thanks for supporting me and what I do. Thanks. Good night, everybody.